Hi, welcome to Everything Neuropathy. My name is Dr. Karen May, and I am the owner and physician at Momentum Health Neuropathy Center. And today we are going to talk about the traditional medical model approaches to treating neuropathy. Please take a look at any of our other videos that I've done in the Everything Neuropathy series, including one with Dr. Ramona Wallace that goes into a bit more detail, but I just want to give a high level of what the traditional medical approaches are to neuropathy and why it's not so promising. And also check out our video as to why doctors tell you nerves can't heal. And I mean, there's so many others, and so this is going to be a little bit more high level. The traditional approach to diagnosing neuropathy in the first place is having symptoms, kind of waiting and seeing if they progress. Maybe it's trying a medication for pain. I did an entire video on the types of medications that are recommended, what they actually, the type of medication it actually is and what it's actually doing. But understand the whole goal is they'll try the medications to just dull the pain and make it more bearable. I'm not opposed to that, but at the same time, the destruction is still going on in most cases. So you just have to keep upping and upping the medication to the point where then they just don't have any more options. The other, then if the medications don't work, or maybe your doctor right away moves to do what's called an EMG, checking to see what is going on with the nerve. They're looking to see if there's any issues going on at the spinal level. They're looking at what the nerve signal is doing. They'll literally stick needles in or put patches on the skin and send electrical signal and measure it to have an understanding of what's going on with the nerve. And sometimes other nerve fibers aren't identified that way if they're damaged, so they'll do what's called a punch biopsy of the skin, looking for the particular types of nerve fibers. And maybe they'll do blood tests, looking for any underlying causes, such as heavy metal toxicity, maybe low vitamin B12 levels. So they're looking for other causes. So the traditional approaches to treating neuropathy is getting that information, and the treatment's pretty standard. Some B12, some medications to manage the pain, maybe some physical therapy, and that's truly the extent of how they are treating neuropathy. 25 million Americans have this. If you're searching this, either you or a loved one has it. I had it, and so that's the reason why I work with people who have neuropathy, is because I was told the exact same thing you were. There's nothing that can be done. Live with it, and when you need symptomatic pain relief, let us know. So those are the traditional approaches. And why is it not so promising? Because neuropathy can be a very progressive disorder, and and doctors also tell you there's nothing that can be done besides pain control. That's a pretty sad existence when they don't live in your body and live with the numbness and the chronic pain, maybe the loss of balance, maybe you can't hold things. That's just not the right answer if anyone's been through it. So that's the reason why we take a different approach, and we'll be covering that in much more detail. But if you are seeking help from your medical doctor, push them to see if they have anything else, if they can do anything more besides B12, PT, and also medications. And there's usually 3 different categories of medications that they'll use. So see if they'll do something more than that. But if you want to know how severe your neuropathy is and just take a quick quiz, don't hesitate, take it it'll be in the link below. We also have a great webinar to understand a little bit more about what neuropathy is, the typical medical approaches. I go into a little bit more detail. And then we talk also a bit more about a natural approach that I've used on myself, refined it for myself, and now over 350 clients. So we would love for you to check that out too. Have a great rest of your day.